School on Grant Street in New Orleans East. Local healthcare experts will be on hand to answer questions, and that meeting starts at 6. Hundreds of people showed up for a congressional town hall meeting on healthcare on the North Shore, hosted by Congressman Steve Scalise. Natasha Robin was in Mandeville last night and has the story.
For Congressman Steve Scalise, this was his 6th and final town hall meeting. It was the last chance for people to ask questions and get their voices heard about the health care reform bill. The Fontainebleau High School gym was packed. Not a seat in the House was open, and about 100 people actually stood up through the meeting. Congressman Steve Scalise brought with him the Department of Health and Hospital Secretary Alan Levine. Both men talked specifically about House Bill H.R. 3200, which passed the Energy and Commerce Committee and is awaiting passage by the House. This is the most controversial bill, and the bill backed by the Obama administration. The 1,200-page bill is extremely confusing for a lot of people. Both Levine and Scalise are against the health care reform bill for a number of reasons. They both say they want reform, but both disagree with the way the Obama administration is going about it.
We've got big concerns about President Obama and Speaker Pelosi's plan to try to have a government takeover of health care, and I share those concerns. In fact, not only did I vote against their bill in committee, but I've also co-sponsored a bill that I think addresses the problems in health care, but without government coming in and taking over the system, without the taxes and all the mandates. So I think we really need to have a more honest conversation about how to fix problems in health care without the government literally coming in and taking everything over and breaking all the things that make medical care work in this country.
It gives the Health Choices Commissioner the exclusive power to set rates and payment methodologies as to how they're going to pay providers. It gives them the exclusive right to do that. And the language of the bill also says that there is no administrative or judicial recourse, meaning that a government-appointed person, a bureaucrat, with no accountability, they don't have to face the voters, gets to decide what providers are going to be paid, and that's me, and that is frightening. That is frightening to me. For someone like me to have the power to do that is wrong. And I will tell you,
Scalise is encouraging people to stay informed. He's also encouraging them to call his office while this debate continues on Capitol Hill. Scalise will head back to Washington, D.C. on Tuesday and says he will bring back with him the opinion of the people he represents. Reporting from St. Tammany Parish, Natasha Robin, Fox 8 News.
Senator Mary Landrieu told us by phone yesterday that as the House plan stands now, she would vote against it. She says the focus